So what are some of the important things to actually discuss with your doctor and with your healthcare team about this therapy? Well, it is important to be on the same page about what is the goal and expected outcome of this treatment, right? And different patients, I think, have very different goals, and it's important to understand that kind of from the outset. For that reason, discussing your expectations with your physician, your healthcare team is, of course, critical as well. The expected duration of treatment and side effects, very important here. And we discussed some of that a little bit earlier. And then I think it's important to define or at least discuss what does success look like with treatment like this? What are we aiming for, right? And again, this is very different for different patients and can be affected by a wide variety of things, right? Um, and then an absolutely critical thing is to always discuss the extent of your side effects actually after already starting therapy with your doctor. Because again, I think that's an absolutely critical part of successful treatment because it does affect how we give this regimen, how we adjust doses, and really what we do. And, for a patient to exercise, to express themselves and their voice in that situation is absolutely important. So what is the future of this therapy? Well, increasingly, I think we will see more and more patients with urothelial cancer receiving this treatment. And actually, even in the time since I made these slides, which was just earlier this week, this is already proving to be the case because just a couple of days ago, we actually heard a press release from results of a clinical trial of this combination for patients not with metastatic disease, but with muscle invasive bladder cancer. So patients who are treated with this therapy, this combination treatment, followed by a surgery to remove the bladder, with the attempt to, of course, get rid of the cancer completely to cure it. There is a clinical trial that investigated this combination treatment specifically in that patient population that we now know is positive, meaning it's better than the prior standard of care, which likely means that in the coming, months to years, the FDA will likely approve this therapy. Again, we have to see the data first, but usually big positive trial like that leads to an FDA approval for a very different and a broader patient population, those with muscle invasive disease. And so I think, when we talk about this combination a couple of years from now, it'll be a much broader kind of population of patients that is being treated with this. We will have a lot more experience with this therapy. We'll have more information about, side effects as well and their expected resolution as more and more patients kind of are treated with this. So to summarize, enfortumab vedotin and pembrolizumab, the combination we're discussing today, is a very effective treatment option for patients with advanced bladder cancer. It has led to significant strides in the care and treatment of patients with this disease. And that has changed even again in the time since these slides were made earlier this week. It significantly exceeds outcomes, this combination, relative to what we were seeing with prior standard of care therapies like chemotherapy. But on the other hand, it is associated with a specific side effect profile that we have to keep in mind. We have to monitor and manage very carefully to really allow more patients to achieve greater success on this treatment. And with that, patient communication with their treatment team is absolutely key and absolutely critical. And that's why, again, I think it is especially important to hear the patient voice in all this and really how this treatment affects your day to day and how it really can help many patients. And that's why I'm really glad that we have a patient today to describe their experience with this as well. But in the meantime, I again thank you for your attention with this and look forward to the questions and the discussion later.
Consulting. I also have a second part-time job, and that's my cancer treatment. I do approach it as a job. I was diagnosed with stage 2 bladder cancer in the fall of 2016, and it has since progressed to stage 4. I've gone through numerous treatments from procedures and surgeries, immunotherapies, chemotherapies, radiation in various combinations. And currently I am on the enfortumab pembrolizumab combination. I started enfortumab in November of 2022 and added pembrolizumab about 1.5 years ago. So far, I'm having a good response to it, to the treatment. It has manageable side effects for me at this time. It's mostly fatigue. I can't blame all the fatigue on this combination, though. I've been fatigued for some time with all the therapies I've been on. I do have a bit of neuropathy in my hands and my feet in the form of numbness, and I have a variable appetite. Some days I'm not hungry at all, and some days I want to eat the house down. Um, the other thing I wanted to point out for this therapy is I do find it relative convenient to take. On those days, on day one of this 21-day cycle, when I receive both the enfortumab and the pembrolizumab, the infusion time is a total of 1 hour. It's 30 minutes of time for each drug, which adds to 60 minutes. And if you've been through other treatments, for instance, cisplatin or some of the other platinum-based drugs, you know, they could take a lot longer and you may be in the infusion center for some time. So that's one thing I really appreciate about this combination. You know, living with cancer since 2016 has taught me several things, and Patricia asked me to share some of these with you. First and foremost, I'm much more thankful than I ever was. I'm thankful for every day that I have, as well as the people in my life, both the old and new folks who have met along the way. I'm thankful for the experiences I've had, as well as learnings that have changed and altered me and how I behave. I try to live in the present and have no regrets. A little bit easier said than done, but I do focus on the now, not the past and not too far in the future. And I live with what's called an open hand, which is letting go of those things that really don't matter and try to capture all the good things that come along. I do try to be more kind and patient. Another thing that's a work in progress, but still achieving to be better. And lastly, one of the things I think we've all probably learned about ourselves is that I'm stronger and braver than I ever thought I was. And so are you in the process, I know. While I realize I'll ultimately lose this war, I've been fortunate to win a lot of battles with the help of many people. I continue to learn about the disease. I'm living with cancer. And again, I want to thank Dr. Koshkin and the Bladder Cancer Advocacy Network for inviting me to be here today and sharing some of my experiences with everyone.
Thank you, Robert, for accepting our invitation and being able to share your experience with others. You talked about some of the side effects that you experience, fatigue being one of them. Could you tell us a little bit about how you manage that particular side effects or others?
Sure. You know, everyone's cancer experience is different, and obviously I can only speak to mine. But the symptom that I have that affects me most on a daily basis is fatigue. As I said earlier, I can't blame this entirely on my current treatment with enfortumab and pembrolizumab. You know, I've been on therapies for some time, and my fatigue goes back for some time as well. But I typically try to fight this in two ways. First, I rest when I need to rest. I try to plan my days to ensure I have time built in to rest should I need it. And to be honest, I'm okay with going to bed by 9 p.m. if I need to. Second, I try to exercise regularly, most often in the form of foot walking, as I get both a physical and mental benefit from it. I had a very wise nurse once tell me that exercise is the enemy of fatigue. And she told me that if I can't walk for 20 minutes, to walk for 10. If I can't walk for 10 minutes, then walk for 5. And her main message was just get up and move. And it's true. You know, the hardest part is just getting started each day.
Thank you for sharing that tip. And that leads me to wonder, Dr. Koshkin, you shared many different side effects that result from this therapy. Um, I'm curious to know what are some of who else is part of the I guess the team that helps manage patients, and um, also what are some of those um, surveillance or tests that are done as patients are on these treatments besides the ones that you mentioned during the your presentation.
Yeah, that's a great question, and I think it's absolutely important and critical to highlight the importance of the healthcare team, right? Which is so much more than just than the physician, right? It's the you know, Robert knows all these people on my team because he you know, they interact with them very closely. But it's you know, the nurses who you know, work closely with me and then work closely with patients and you know, help patients, you know, manage side effects and then, you know, communicate those to me and communicate other things to me, right? That patients express. We have nurse practitioners as well who are you know, are able to see the patients and also, you know, prescribe medications and you know, prescribe certain interventions in actually the same way that physicians can, right? There are, you know, actually non-medical, well, non-clinical personnel, I should say. So the schedulers who make sure that, you know, the infusion is of a, you know, given treatment is timed correctly with, you know, the appointment and things like that. And I think their role in helping patients kind of navigate all that is very important. And then we have a lot of colleagues from other teams that help manage, you know, side effects or some of the other complications as well, right? So Robert mentioned, you know, things like fatigue, right? And I would add to that that you know, like appetite loss and other you know, symptoms that our symptom management colleagues actually help with a lot. And those are, you know, additional doctors and additional nurses and nurse practitioners who work with them who focus on that aspect of cancer care, right? Which is, you know, goes in parallel with treatment, but is, you know, probably just as critical, right? It's actually making sure that the patients can you know, feel better and you know, deal with and tolerate some of these challenging treatments better as well. And then, of course, if more significant, or well, I shouldn't even say more significant, but side effects that require other medical input happen. So things like, you know, inflammation in the lungs that I was alluding to earlier. Then, you know, we often involve other physicians as well. So like pulmonologists that focus on the lungs, right? Or physicians that focus on the liver or GI tract. So in many instances, well, dermatologists as well that help with rashes that are, you know, a common side effect here. So in many cases like that, it ends up being, you know, quite an extensive team that a patient interacts with. We're talking about like tens of people, right? And quite a lot.
Thank you for explaining that. And I know that's something that came up when Robert and I were discussing, and he was praising his team at UCSF. Um, I'm curious to know, in terms of the how widespread this treatment is available. Is it available outside of non-academic centers, say, for example, community-based practices?
Yeah, at this point it is. Uh, as you know, in most treatments in oncology, initially when it's part of clinical trials, it's only available, yeah, at academic places that run those trials. Although many community practices now actually run clinical trials as well, right? So you can seek out that therapy there. But once it's well, FDA approved and more widely available, you can really get it anywhere. I think there is some geographic variability with uptake of this particular regimen. I think certainly in, well, in, you know, Northern California where I practice, I think it's been, you know, pretty widely used. I don't know if that's the case in all areas of the country because actually, I mean, we've seen actually some data that, yeah, in many places it hasn't actually probably been used as broadly as it should be given the really positive data we're seeing, right? So in some places, it's still, prior therapies like chemotherapy are being used when, I don't know that there's a strong reason to do that. But overall, I mean, yeah, I think in the last year and a half, we've seen a lot of uptake with this. We have, pretty good data now, again, suggesting how patients with this do in what I call the real world setting. So outside of clinical trials, but in everyday practice.